You were one of the former commissioners who put out this really extraordinary editorial in the New England Journal of Medicine arguing that the FDA and top vaccine regulator, Dr. Vinay Prasad, are changing policies in a way that's going to slow down new and better vaccines. What specifically is the problem you see? Because this isn't just Hep B. This is the vaccines of the future you're saying just won't be created.
Right. So Vinay Prasad, who is the head of the Biologics Center, also oversees the vaccine division. He also has been appointed the head of biostatistics, the chief medical officer of the agency, and the chief scientific officer. So he occupies a lot of positions. Put out a memo saying that they're going to do away with or move away from what they call immunobridging studies. These are studies that allow you, for well-validated vaccines like the flu vaccine, to be able to demonstrate each year that the vaccine, the new vaccine that's formulated against a circulating strain, can elicit antibodies that are effective against that particular strain, and that could be the basis of approval, rather than requiring new outcome studies every year to prove that the vaccine actually reduces the incidence of influenza. For established vaccines where we know that antibody production is a good correlate for immunity, this has been a long-standing practice. We do it for flu vaccine, we do it in COVID certainly, we do it for things like pneumococcal vaccine, the vaccine for pneumococcal disease, where we look at serotypes, circulating bacterial serotypes. This allows us to update vaccines as these viral and bacterial strains change and as the composition of the strains change in time to provide protection for the fall respiratory season. If they move away from this, which is what he said they plan to do, we're just not going to be able to update vaccines each season as we've done historically to accommodate whatever the circulating strain is.
And 12 former FDA commissioners came out saying they're deeply concerned about what is happening. That memo that made clear the changes that are happening within the FDA from Dr. Prasad was obtained by CBS, and it claimed that career FDA staff are making changes in part because they found at least 10 children have died after and because of receiving the COVID vaccine, referred to it as a profound revelation, and asked, did it kill more healthy kids than it saved? The administration to date has not backed up information to back up these claims, but what questions do you have for the FDA commissioner? Because they're arguing they're doing this to help people.
Yeah, look, well, first of all, one thing doesn't flow from the next. So the idea, if in fact they found cases where the COVID vaccine was linked to tragic deaths, it doesn't then follow that you make these policy changes. In fact, the policy changes wouldn't address what their concerns are related to the COVID vaccine itself. Every case needs to be carefully adjudicated. It's tragic to see any suspected case that could be linked to a vaccine. And these were looked at previously by the FDA, and I don't believe that the new FDA had access to the case-level data. Analysis of cases, individual cases that get filed with the agency where there is a death in proximity to vaccination, and some of these are filed by the manufacturers themselves, are very subjective and require the goodwill of the people involved in that. And so I think that they should make that analysis public so it could be scrutinized and people can get comfort in it. They've already backed away from the 10. There's reporting from endpoints that now they're saying it's 8 or 9. So they're already backing away from it.
Okay. And HHS said they will eventually make that data public. We'll look for it when it comes out. Dr. Gottlieb, thank you for your analysis today. We'll be back in a moment.